Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Here is what I bring to you from the world of medicine. Researchers at UCF developed novel sponge-like bandage to prevent excessive bleeding. Without proper medical intervention, injuries sustained from traffic collisions, serious workplace accidents, or weapons may result in fetal hemorrhaging. University of Central Florida researchers aim to prevent such bleeding in potentially deadly situations with a new hemostatic sponge-like bandage with antimicrobial efficacy that they recently developed and detailed in a newly published study in the journal Biomaterials Science. The method Kausik Mukhopadhyay, Assistant Professor of Materials Science and Engineering at UCF and study co-author, and his team developed is called SilFoam, as it is more of foam than a traditional bandage wrap. SilFoam is a liquid gel comprised of siloxanes that is delivered via a special two-chamber syringe which rapidly expands into a spongy foam upon exposure to each other within the wound in under 1 minute. The sponge applies pressure to restrict the hemorrhage at the delivery site while also serving as an antibacterial agent because of the silver oxide in it. For every 5 milliliters of gel injected, you can expect an expansion of about 35 milliliters. Mukhopadhyay says, anytime you have a profuse bleeding or bleeding, you want to press on top and stop the bleeding, he says. So what we did here is actually the same thing. Instead of putting the hand, we injected it and it creates a voluminous expansion. Mukhopadhyay and his collaborators found that their sponge also resulted in a more gentle removal. During the reaction, it generates a little bit amount of heat that helps the process very fast, he says. On top of that, oxygen gets as a part of the reaction's byproduct tries to come out. So instead of making it a cross-linkable rubber, it's a soft sponge with a lot of internal porosity. They use specially crafted mannequins designed with realistic blood vessels and wounds developed by a local company called Symmetry to test their foam on in hopes the preliminary results were promising enough to proceed with further testing. One of the most important parts of this was that we used non-invasive models, Mukhopadhyay says. At this stage, there are no psychological effects on vets or surgeons either. The experimentation showed promise, especially when the researchers compared SilFoam to 5 other existing treatment methods. They found that SilFoam had many advantages such as significantly less leakage, room temperature, storage versus requiring cold temperatures, ultimately lower cost of material, little to no training requirements to use the syringe. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.